Now, lumbar disc bulge, one of the most common clinical presentations that we will see. What does it look like? Well, it's usually an individual who will present with lower back pain with or without the presence of peripheral extremities, so the legs, numbness, weakness, or tingling. Interestingly, sometimes they don't actually have lower back pain, but they'll have the peripheral symptoms alone. As someone who has 3 lumbar disc bulges, that is me. I don't have much back pain. All of my symptoms are in my legs. So I notice tingling primarily in the L5 dermatome on the right hand side, as well as intermittent tingling in a couple of dermatomes on the left hand side. So how do we approach treatment for someone who has a lumbar disc bulge? Well, initially we'll start with conservative treatment. So conservative treatment might be something like trying chiropractic, physiotherapy, hydrotherapy, exercise rehabilitation like an exercise physiologist, yoga, those sorts of modalities. Techniques that you might get with some of those practitioners are things like soft tissue therapy to the surrounding lumbar muscles, also pelvic muscles, mobilization or manipulation type techniques to improve joint movement and hopefully reduce disc pressure, as well as various exercises that are again designed to do the same sort of thing: improve movement, reduce disc inflammation, reduce disc pressure. Other type of techniques, perhaps ultrasound therapy to the lower back, laser therapy also. Laser has recently been shown to be quite good at have anti-inflammatory properties. So when a disc is really inflamed in the acute phase, something like that might be helpful. Otherwise, if conservative management fails, then it'll be referral to an orthopedic or a neurological surgeon. In those sorts of instances, there are, again, various types of surgeries that can take place. It might be something like a laminectomy to decompress a disc or decompress a nerve, a microdiscectomy to achieve something similar, where they come in and they almost like shave or take some of the damaged disc away. More invasive or sort of at the upper end might be something like a complete disc replacement, where they take the injured disc out and put a prosthetic disc in. There may be benefits to that type of approach where you're actually maintaining good movement. Otherwise, another technique might be like spinal fusion. Spinal fusion used to be the go-to type procedure for these types of injuries. It's probably done less now, but it is still an option available. So that gives you some of an idea about lumbar disc management options, and I hope you found this video helpful.